Today I want to continue with this idea that in the practice of medicine, tests don't always give you the answers. A couple of weeks ago, I talked about making a clinical diagnosis with regard to seizures, and I described some hallmarks that I look for when I'm trying to make a diagnosis of seizure. Today I want to talk about the diagnosis of dementia. So to start with the definition of dementia, dementia refers to a category of progressive brain diseases that result in a loss of the ability to think and to remember. Now, there are many kinds of dementia. For example, Alzheimer's is a type of dementia, and there are many causes for dementia. But let's just start with the idea that dementia is a brain disease that results in a loss of the ability to think and to remember. Now, when it comes to diagnosing dementia, it's not like I can just get a brain scan and that is going to tell me the answer. Especially in the early stages of dementia, a brain scan can be normal. Even the pencil and paper memory tests can be pretty normal in the early stages as well. So when someone comes to see me because their memory isn't working like it used to, I start by taking a history. I take them back to the very beginning of the story and we start there. So you were fine until when? What did you first notice? The first hallmark of dementia is the time course. Dementia is a gradual process. You don't just wake up one day with dementia. And in the early stages, it blurs into the normal forgetfulness that most people experience, especially as they get older. It's not like a stroke, which happens all at once, which is why they call it a stroke. Dementia creeps up on you, and it slowly gets worse. People can get a urinary tract infection, for example, and one day their memory is working fine, the next day they're confused and disoriented. This is not what dementia looks like. Earlier this year, a friend of mine took his father to the emergency room after he became dehydrated and disoriented. The tests were normal, the CAT scan was normal. They told him maybe it was the onset of Alzheimer's. But this is not how dementia behaves. Dementia creeps up on you. The second hallmark of dementia is the company that it doesn't keep. And this is what I mean by the company it doesn't keep. Dementia, especially in the early stages, is not associated with a change in the level of arousal or alertness. So if a person is very sleepy, if a person is spacing out, I'm going to point my attention in another direction. I'm going to ask them if they're sleeping well at night. I'm going to ask them if they snore. Maybe they have sleep apnea. If it's a fluctuating loss of memory, if it occurs in episodes, I might suspect they're having seizures. Or maybe they have an infection. Maybe they have an encephalitis. Speaking of company that dementia does not keep, if there is significant anxiety or depression, you can't make a diagnosis of dementia. And I see this quite a bit. Someone who is depressed can, to all outward appearances, appear to have a dementia. And even after getting a brain scan, even after memory testing, sometimes it's impossible to tell the difference between someone who is very depressed and someone who has dementia. They call this pseudo-dementia, which means false dementia, because if you treat the depression, the dementia goes away. So if the onset of a memory problem is accompanied by a lot of mood dysregulation, so anxiety, depression, bipolar, PTSD, sometimes it's hard to tell if it's a dementia or not. The third hallmark of dementia is that it brings about a decline in function. So a person used to be able to do X, Y, and Z, and now they can't. So to make a diagnosis of dementia, I have to know about the person. I have to know what they were able to do and what they can no longer do. I can't just stare at a person's face and peer into their brain to find the answer. I can't pull out a mini mental status exam and ask them what the date is or what city they're in. I can't just order a brain scan. I have to actually know about who they are as a person, what they were like 2 years ago, how far they went in school, are they working, what kind of work did they used to do when they did work. And then I try to figure out if what's going on is a change from what they used to be able to do. In other words, how does this play out in their day-to-day life? There's no test that can capture that. Dementia is a brain disease, but it plays out at the level where people are living their lives. And it happens progressively in stages. So the first stage of dementia is what I would call forgetfulness or absent-mindedness, distractible. The person can still do everything independently. It just might take them a little bit more time, or they might make more mistakes than they used to. Some common things that I hear people say is, when I went to another room, I forgot why I had gone there. And family members say that the person will ask a question that they've already answered, sometimes several times, or they repeat themselves. They're scatterbrained. All of this blurs into shades of normal. We're all absent-minded at times. We all forget people's names. And so at this first stage, sometimes you only recognize what's going on when you've moved through to the second stage, and looking back, it becomes apparent that something was wrong. The second stage of dementia is when you start to have trouble doing what are called higher level activities of daily living. So things like organizing your personal finances, remembering to pay your bills, being able to do your taxes, taking your medications independently, being able to drive safely and not get lost. This is the stage when people usually come to see me. It's more noticeable at this point. The third stage is when a person has trouble even with the basic activities of daily living. So they can't sequence the steps necessary to get things ready to take a bath, for example. It has to be set up for them. They have to be prompted. And they need help dressing, not because they have trouble using their arms and their legs, but because they can't organize their thinking enough to be able to sequence one step after the other. They have to be prompted every step of the way. People can be in one stage for years. They can go through the stages very, very slowly. And for some people, they can move through the stages more quickly. It's very difficult to predict how fast a person is going to deteriorate. People often ask me if there's a value in getting another MRI when their loved one's symptoms are getting worse. And I tell them that the MRI is never going to be as descriptive as what you've already told me is going on in their life. So, to review, when you're diagnosing dementia, tests don't always give you the answer, especially in the early stages. You have to get a history, and you have to get at the story of what's going on. As a doctor, I'm trying to identify some of the typical hallmarks of dementia. Does it have a slowly progressive course? Does it creep up on the person? What company does it keep? Is there a change in alertness or a mood dysregulation that might better explain the decline in thinking and memory? And lastly, stepping back to view things at the level of the whole person, does it bring about a degree of dysfunction in the things that a person is normally able to do?